Denver. This is Fox 31 News at 8. We're on it.
A pediatric mental health state of emergency declared in Colorado.
This morning, we're live with a doctor addressing that crisis, learning more about what help is out there right now. 8:12 right now. Earlier this year, Colorado Children's Hospital declared a pediatric mental health state of emergency, and the state is now responding. Governor Polis recently signed 2 bills aimed at improving mental health services in our state.
One measure creates a new program in the Office of Behavioral Health for young people aimed at making it easier for them to get services. It'll provide anyone under the age of 18 with a mental health screening and reimburse their providers for 3 mental health sessions. Dr. Barbara Kessel from Pathlight Mood and Anxiety Center is live with us this morning to talk more about how we approach this. I mean, a state of emergency sounds pretty serious, but this isn't something that came out of nowhere, right, Doctor?
Yes, that's correct. Mental illness has always been present in children and adolescents, but the pandemic has really tested our young people and their resilience because of unprecedented degrees of isolation, stress, and really just uncertainty in their lives.
Well, first you have to be able to talk about it with your kids and identify it. Is there any certain type of behavior that children may be exhibiting that could be a cry for help, that they may be struggling with this?
Sure. So things that parents really want to key into are changes in their kids' moods or behaviors, drastic changes in their sleeping habits, so staying up late, sleeping late into the day, and changes in their diet and exercise routines.
Do you find that parents often say, I just never thought that this would happen to my family or that we'd be dealing with this with my kids? I mean, I feel like, as a parent myself, there's just always a sense of like, oh, well, everything's great here, but it's not that easy. It's not that cut and dry, is it?
Yeah, I think that's right. I think, it is really important to realize that this can happen to anyone, and especially under, these really, trying circumstances of the pandemic. People don't really know how to deal with this kind of a stressor.
Well, Dr. Kessel, is there anything we can do on the front end to help encourage healthy coping behaviors before it escalates to a hospital visit?
Absolutely. I think it is really important to make sure parents know what kind of resources are available to families and children. I think people are really familiar with the outpatient treatment model and, getting kids into therapy. And so it's also important to realize that, if your child is already in therapy, there are higher levels of care. So if weekly appointments aren't enough and you're having to go to the emergency room or worried about your child's safety, it might be worthwhile to look into higher levels of care. So higher levels of care include things like intensive outpatient treatment, partial hospitalization, where, kids are still living at home with the family. There are also residential treatment programs where, they may spend some time living at a facility for a period of time while, the team helps the family work on, new ways to support their teenager, and also teaching the teenager or adolescent new coping skills and ways to deal with stress.
Are those the type of services you all provide at Pathlight?
We do. That's correct.
All right, Pathlight Mood and Anxiety Center, Dr. Barbara Kessel, thank you so much for talking with us. I mean, certainly a conversation that we just have to keep having, right? Because we got to get rid of that stigma that therapy is bad or weird. It's not. I mean, especially with this state of emergency, we've got to make sure our kids are healthy in so many ways.
Should be having those conversations, absolutely.